presence of so much data around healthcare, it allows us to be more informed, more thoughtful about how we intervene with an individual member. So although we're dealing with populations, right, in the United States, somewhere around 330 million members, all but about 45 million of which are insured, we really need to deal with them on an individual basis. So the data that is available in the marketplace, the managed care data, the care data that makes up their healthcare records, their laboratory information, their pharmacy information, their historical disease and comorbidity information, allows us to better deliver care for them, to achieve a better quality outcome, a more accurate understanding of their disease and comorbidity status, which equates to what's called a better risk score understanding, and ultimately better utilization, better actual expenditures, because if we can keep that patient well and have them managed more effectively, obviously we can decrease the costs of treating acute exacerbations. So in a number of diseases, take diabetes as it's frequently referenced as a pandemic even around the world, the rising rates of diabetes are quite alarming. Diabetes is a complicated disease. Diabetes has complications of neuropathic, of nephrotic, of optical, many different things that decrease the quality of life and increase the cost of managing it. For a typical patient, managing through the care of their diabetes is quite complicated as well. Taking the right medications at the right time, seeing the right physicians and care providers at the right time, following up in the right intervals, and understanding what to look for as complications of their own condition. So in the setting of having good, solid data around that person's care plan, that person's care outcomes and care progression, what medications they're on, where their hemoglobin A1C stands, what is the progression of their eye complications, their peripheral neuropathic complications perhaps, what levels of insulin they might be needing or oral hypoglycemics they might be needing. These things allow us to help guide that member through a more effective care plan so that they ultimately have fewer complications and a lower cost of care and higher quality of life. So specific examples, what we see is if we can coordinate this together, we've seen dramatic decreases in the emergency room visits of diabetics from their complications. We've seen drops in 22 to 25% in the number of emergency room visits over the course of a year in a diabetic population. We've also seen dramatic decreases in complication rates, complications such as gangrene in the peripheral, osteomyelitis. These are common complications of diabetes. We've seen these drop by as much as 30–35% in the population when you use data on a population basis to be able to deal with, manage, and help through an individual.